Hello and welcome to another episode of A Slice of Health, the Candid Health Chat podcast, where we slice away health truth from health fiction. Join me and my friends as we challenge common health myths via chit chat, powered by several cups of coffee. Don't forget to subscribe and follow us on social media, and do visit us at asliceofhealth.club. Let's get to today's episode. After over 2,000 years of being a disease recognized by human beings that afflicts the mind and the body, there is a vaccine program against gonorrhea. It's Monday, the 4th of August, 2025. Welcome back to A Slice of Health, where health comes alive with bite sized health education to keep you moving and become your own health champion with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Michael, a 27-year-old man, recently read the news this morning and it said that there is a new gonorrhea vaccine available in sexual health clinics all around England. He has read lots of commentary about this, something about antibiotics, something about this being an injection, queries as to why a sexually transmitted infection would need an injection vaccination. Michael has many questions. He wants to know if this is something that he should use preemptively or if this is something that he should never even consider. He is up to date with all his regular vaccinations, at least the ones that he had as a child or as a teenager before he went into university. Michael is unsure. He has seen several comments online suggesting that he talk to his GP about needing this vaccination. Some people said he needs to walk into hospital to get the vaccine, but he feels that that sounds a bit out of the ordinary. Michael wants to know, what exactly does it mean to have a gonorrhea vaccine? And what exactly does it mean to need a vaccination for a sexually transmitted infection? So today, we're going to answer Michael's questions with simple facts that go directly to the truth. So Michael is correct. Today, the NHS announced that a gonorrhea vaccine would be available in sexual health clinics all around England. What does this mean? This means that these vaccinations are a protective and preventative measure from public health. Vaccinations generally are inserted into the human body to trigger an immune response as though the body was actually fighting the infection. But what that then means is that you have antibodies, which are basically like the military protective system in the body that then fight infection. And so if you then became exposed to gonorrhea at a later date, the increased chance of your body fighting away that infection is higher than in somebody who did not have the vaccination. Now, vaccines are actually very, very effective, and only a very small or minute number of people who get vaccinated against any infection end up having it. So, we consider vaccinations to be a highly effective public health strategy to prevent the passage of disease and its transmission. Now, gonorrhea in itself is what we refer to as a sexually transmitted infection, and it has been with us for many, many years, even centuries. So, what exactly is gonorrhea? So, as I said, gonorrhea is a sexually transmitted infection. You might have heard of it referred to as an STI, and that's what it is, a sexually transmitted infection. Now, it has existed for many years and has been around in men and women. It can affect the genitals, the mouth, or the rectum, and is usually spread by sexual contact with somebody that is infected or from mother to child during birth because of the nature of pregnancy and delivery. Some of the symptoms associated with it include a stinging sensation during urination, a discharge from the penis, and sometimes it can also cause something called pelvic inflammatory disease that can also lead to issues with fertility and also cause pelvic pain as well. Now, gonorrhea tends to affect less than 1% of men and women around the world. And in some situations, really rarely it can cause death. Over the past few years, as you must have seen, there has been an increase in what we call antibiotic resistance. This is relating to all infections that we use antibiotics to treat. There are many reasons for this. The first is that we use a lot of antibiotics in situations where we don't need to. The second is also relating to inappropriate use of antibiotics and problems with completing dosing. Now, gonorrhea is one of the infections that needs antibiotics to treat it and clear it out of a person's body system. And with the increasing risk of antibiotic resistance, there has been a lot of research in trying to figure out ways to minimize the risk of people developing bacterial infections. And so a vaccination is a step in the right direction. So, what other vaccines do we have for sexually transmitted infections? First, we have the human papilloma virus, often referred to as HPV, which can be sexually transmitted and is known to cause cervical cancer. In the UK and in many other parts of the world, the HPV vaccine is offered to young ladies before they start having sexual interactions to protect them and prevent their risk or reduce their risk of developing HPV related cervical cancer. So, what we know is that a vaccination would help reduce the risk of people developing gonorrhea, and it would also reduce the risk of those complications which I referred to earlier, which can cause significant issues in health and quality of life. So, we've said that today NHS in England has announced the rollout of this vaccination program specifically for gonorrhea. Who does this affect? First, it affects those who have multiple sexual partners, those who have had an infection, specifically a sexually transmitted infection of bacterial origin in the past 12 months. Now, this vaccine is going to be free. And so, anyone that fits into that category is welcome to speak with their sexual health clinic as to their eligibility to have that injection and to have the vaccination program. Not only would that vaccination protect the person receiving it, it would also protect their sexual partners wherever they meet or find them. So, as we go forward into this new era with the vaccination program, we would then start to see studies and understand what exactly has been happening in terms of the incidence of gonorrhea. Because what we know is that over the past few years, the incidence of gonorrhea specifically as a sexually transmitted infection has been increasing steadily. So there you have it. There is a new sexually transmitted infection vaccination available in England from today. It is free and it is available to those who are at highest risk of being exposed to gonorrhea. So if this applies to you, please speak with your local sexual health clinic as to how you can get this vaccination. And if it applies to someone that you know, then send this podcast across to them. Well, that's it for me from today. I hope you've enjoyed this episode. Until I'm back in your ear tomorrow with health facts, health information, where stories heal and knowledge empowers. Bye for now. Thank you for joining us on today's episode. Remember that this podcast in no way replaces the advice you receive from your own doctor or physician. Don't forget to subscribe and follow us on social media. Leave us a review on iTunes so that others can access the amazing content. And don't forget to be a health champion wherever you are by separating health fact from health fiction.